COVID-19 has impacted and affected everyone in the country. Millions are out of work, and thousands more have fell victim. One segment of America that has been hit the worst by COVID-19 is the Black community. Some of the research and data we are seeing when comparing the infection rates between white and blacks is pretty astounding. Today we will explore some of the reasons why African Americans seem to be the largest group affected by this worldwide pandemic. The Black community has always had struggles with certain health issues. Diseases that are usually associated with the community include diabetes, hypertension, and upper respiratory problems. These comorbidities have been found in blacks more than in any other race. One statistic in a New York Times article states that in a study by JAMA, black men were 67% more likely to get diabetes when compared to whites. Studies have also shown that many of the underlying health issues that are common amongst black people leave a lot of the people in the community at a higher risk to contract the coronavirus. Not to mention that many of the jobs people have in the black community tend to be workers who are currently at the most risk, including nurses, daycare providers, grocery store workers, and fast food workers. When corona first started to affect Americans across the country, there was this really strange myth going around social media.
There's this myth that black people or people of African descent cannot get coronavirus. I have no idea where this notion originated from. There is nothing inherent about us as black people, Afro-Caribbean people, people of African descent, melanated people, however we identify ourselves. There's nothing inherent about us that prevents us from getting this infection. And I know of multiple friends, acquaintances, and colleagues who are black people who have family members who have succumbed to this infection or are critically ill as a result of it. So we are not immune.
What a difference a few months can make. On top of being the most likely to catch the virus, black people across the country have to deal with losing their jobs or forcing to shut down their businesses, adding to the despair in the black community. Numbers that have been released by various health departments across the country are very telling, especially when considering the black populations of these states and cities. In Chicago alone, 70% of the cases involved African Americans.
72% of your city's deaths have been among black Chicagoans, according to your office, even though they make up just 30% of the city's population.
In a few states over in the city of Lexington, Kentucky, the black community finds itself in a similar position. I spoke to Casey Allen Bryant, chairwoman from the Lexington Health Department. I asked her why she thinks coronavirus is impacting the black community the way it has in Lexington. She believes that the issue isn't solely health related, but more based on finances and race. Get more into the data aspect of
Sure.
Read in the article. I read that 30% of the total cases in Fayette County were from black patients, and the black population in Lexington is only 15%.
Yes.
And the divide amongst blacks and whites in Kentucky is also pretty outstanding.
Mm-hmm.
The poverty rate in Kentucky is 17.1%, but for blacks it's nearly double at 30%.
Right.
But do you really think the lack of insurance or the ability to just afford healthcare is the main reason why this is impacting not even just black communities, but like minority communities in general?
Sure. It's a combination of multiple factors. There is some distrust for the healthcare system, which prohibits us from obtaining health care as quickly as maybe some others do, but also because we not necessarily have the means to. We may not have the transportation, we may not have the health insurance, we may not have the money to access. Most insurance companies, you do have to pay some type of copay unless you qualify for Medicaid, and so which still has a minimum copay. So that is a limitation for people. If you watch the video, I love it. Divine Karamba says, when I was growing up, going to the doctor was a luxury that we could not afford. And so for many people, that is true. Also, I think it affects us. I think the virus affects us a lot more too, because we just have those comorbidities that, you can look at the data, whether it's national, local, or statewide. African Americans, we have more hypertension, more diabetes, more likely to have complications from it, and at younger ages. And so if you put all those combined factors together, you can see why we are just waiting for something like COVID-19 to hit us in higher percentages than our Caucasian and Asian and Hispanic counterparts.
And just another question off the questions I sent you. As a nurse, as you being a nurse firsthand, have you seen this at all? Just working recently.
So my job currently, along with chairing the Board of Health, I am a faculty person at the UK College of Nursing, as well as I work for an occupational health company. And so I don't provide direct patient care anymore. Mine is more in the academia setting. And so I have not seen this, but back in the day when I was actively practicing nursing at the bedside, yes, I did. I not obviously it wasn't COVID, but I would definitely see more cases, more complications from diabetes and hypertension.
And doctors across the country have been saying that people who have underlying health conditions like diabetes and asthma are at greater risk of catching COVID. Data that I found from Kentucky Minority Health Report shows that Blacks have these conditions at a higher rate than whites do, and die as a result of that higher rate. And again, do you think this is a result of lack of insurance and more of a distrust with doctors in general?
It's probably a combination of both. There's also, I mean, we don't talk about this often. There's also some stigma and racism that still happens, and so it's not just distrust, but once you do access healthcare system, I mean, it's been studied. For example, in terms of pain medication, African Americans are less likely to get stronger pain medications than our other counterparts. And so there are some culture in place within healthcare systems that still allude to the racism and the prejudice that decrease our quality of care.
Dr. Howard Foreman, director of the Healthcare Management Program at Yale University, adds that coronavirus didn't come from the less fortunate in our country, but rather from rich people who traveled in and out of the country before Corona and unknowingly passed the virus down to the poorest sectors of our country.
You were quoted by saying coronavirus essentially started off, not necessarily started off, but it essentially traveled from rich people who afford the luxury of traveling, and then passed on to a more poor segment of our society. Can you elaborate on why you think this was the case, rather than the notion that the virus strictly came from China and that's the reason why this is all happening?
Look, there's no intention. The virus doesn't have, self-determination or anything. The virus began spreading presumably from China and into Europe and beyond over the last 6 months, perhaps starting as early as November, maybe even earlier, who knows. And the nature of that type of spread requires air travel. It certainly wasn't occurring on foot. And so it's not surprising that the earliest cases in the United States were, quote, imported cases. They had to be imported, and importing occurred via airplanes. And while there are some lower income people that will travel by air, the vast majority are people of upper middle class and richer strata. And the original outbreaks all were fairly predictable, even if we couldn't have predicted them in advance. But in retrospect, they certainly should have been predictable. They were in richer communities in the Northwest, in California, in New York, in Connecticut, a conference in Massachusetts. And that's where it seems to have started the seeding process. And most of the early cases were richer people that traveled a lot, including celebrities, including basketball players. Then it started to move into the community per se. And who are the people that are most at risk in the community once you're no longer relying on air travel? It's people that live in crowded conditions, who use mass transportation, who probably work longer hours, and a lot of things that fit into the rubric of social determinants of health. Combine that with the fact that the populations that it hit, that it ultimately was hitting, were populations that, because of social determinants of health, are more likely to be overweight, hypertensive, have asthma, and other things of that ilk. And you set yourself up to see a spread of disease and the sequelae of disease hitting the poorest in our society and communities of color.
Mm-hmm. In Connecticut, the situation is eerily similar to the one in Lexington. In a story from the Connecticut Post, one of the richest counties in the country, Fairfield County, has two groups of people going through two completely different quarantine experiences. For the rich people in the county, many have essentially halted all movement, while the poorest parts of Fairfield County are left having to go to work and deal with the environment. Albertina Baptista, Director of Health and Social Services at the Bridgeport Health Department, goes into some detail on the current situation in Bridgeport and what they are doing to help out those in need. The health department been working with Bridgeport and St. Vincent's Hospital to help, flatten the curve a little bit for coronavirus.
Well, what I do is I check in with them every day to see, what's going on with their census, what is their surge capacity, how many people they've tested overall, how many are positive in our Bridgeport residents, how many deaths have occurred, just so we get a sense on what's going on within their facility and even at their testing sites there. And then we just kind of compile all this information that we get. We report it up to leadership. And based on that, we sort of plan and see what more can be done to try to flatten the curve. But it takes everyone working together, because as much as you put information out there, if people don't apply it to their own lives and realize that it takes all of us working together, then, it can't work any other way. People will continue to become infected, and unfortunately, we will continue to see a number of people die from this disease.
And just one more last question. Have you noticed any decrease in some of the cases just by talking to some officials at Bridgeport Hospital and St. Vincent's, or has it been?
Well, there was for 12 straight days a decrease in hospitalizations, but that's sort of increasing slightly. So they're looking at that all across the state, because these are some of the things that they monitor in making decisions on strategies to move forward. Getting mask out through the various council members to the constituents. Many of the constituents live in densely populated areas, particularly like housing projects, where it's really difficult to socially distance. Many households have a number of family members living there, and so it's tough. The other thing is also other factors go into play. Oftentimes, people of color are working in service industry, right, or in healthcare, right? So they can't really work at home, as many people are being able to telecommute. And so it puts them at risk of exposure, particularly if they don't have proper PPE to protect themselves. Outside of that, we do know through community health needs assessments that African Americans and Latinos are at greater risk for chronic health conditions, such as heart disease, diabetes, high blood pressure, those sort of things, that based on, the reports that we hear from the CDC and everything, puts them even at greater risk of contracting this virus. So those are some of the things. And then also, I don't know what your course of study is, but just the social determinants of health, in terms of education, housing, access to insurance, those sort of things, all also play a part in it too, particularly when you're from a lower socioeconomic status. Not that everybody is, but for the greater part, based on our population in Bridgeport, there's a greater number of people who are, yeah.
Many have been pushing for the government to start collecting data on the coronavirus, especially when it relates to race.
Important to actually document the race of the people who are infected and dying.
Everyone will be affected by this, but there are some communities and populations that are going to be affected even more significantly.
Dr. Uche Blackstock is founder and CEO of Advancing Health Equity in New York City.
the reason why we need to really discuss this issue and to collect the racial and ethnic demographic data on who is tested, who has the disease, and on who's dying from it is so that we can properly allocate healthcare resources equitably to the communities that need it.
From the 3 people I've talked to, none of them had a specific solution on how to solve the issue amongst Black citizens. And of course they don't. I mean, it's not a simple fix. The issues that have been pervading the Black community for years, like diabetes, lack of healthcare, hypertension, and respiratory issues, are not just going to go away anytime soon. The best thing we can do as citizens of America is just to follow the guidelines that have been set forth by the government. That includes staying inside as much as possible and making sure we all wash our hands and disinfect countertops and surfaces. To fix this means that we will have to start solving the issues that have been around before COVID-19 and finding ways to improve the health condition of the Black community before we can solve the unsolvable, while scientists are still currently fighting for a vaccine.